Hey, it's Birdman for Summit Healthcare's hanging out here in Angie Fabian's office, of course, at Summit Healthcare. Today we've got a little interesting topic. I've got with me Mr. David Harder. How are you, sir?
I'm fine, thank you.
Nice to meet you. So we're going to be talking about something kind of interesting, and actually I'm tied into pretty decently when it comes to helping and supporting. What is that exactly?
Helping and supporting our veterans.
Yes.
I'm a Vietnam veteran as well, and when I was hired,
Thank you for your service.
thank you very much.
Appreciate that.
I didn't serve in Vietnam. I served during the war.
During the war?
Yeah, in on the base
hmm
in Virginia Beach, but I supported a unit that was in the Tonkin Gulf.
It's funny because we just had a conversation this morning. I'm part of the Antares Alliance. We just had a conversation about how to support people. And Vietnam was one of those eras where the veterans was like, well, what's a veteran? Is it at war or not? Support's very important, isn't it?
It was. We had a complete mock-up of the ship on base.
Wow.
And we actually saw MiG fighters coming in before they did. And so we radioed them immediately, said the MiGs are on their way. They got their missiles up, and we splashed the MiGs before they got to the ship. But they were caught unawares. It was about 2 o'clock in the morning.
Wow. So those things are important.
Oh, yeah, they are.
So talk to me about what Summit Healthcare is doing here to support. And we've talked about some of the other things in the past.
Yes.
This is more direct, isn't it?
It is. When I was hired by Wanda Wittenberg, the director of admitting, she was looking to increase her team, but she also wanted to expand services to veterans and care for the veterans. So one of the first things I did was develop a relationship with the VA hospital as well as the VA clinic here locally. And I met Dr. Jeffrey Reres and got to know him personally as well as his team, and actually coaxed them into sharing their personal cell phones with me.
Nice.
That made it very sweet because when we got orders and there were questions about the orders, we could call them directly, find out what they really wanted, and then we would fax it to them. They'd fax it back. And that relationship developed over a period of time. It was really good. We got to where we could smooth this out. And a lot of people were frustrated working with the VA because if you've worked with the military at any time, you understand that there's multiple layers in everything, and it takes forever to get it through the system so that somebody approves it. That being said, that process from the time that the patient saw the doctor till the time we actually saw the patient, let's say you came in and you wanted something as simple as a x-ray of your shoulder because it wasn't working right.
Okay.
So the doctor would order that. It would go from there to the VA down in Phoenix. It would go through some various channels. They would sign it. And then it would go to TriWest, which was the insurance company managing the insurance for them. They would write the order up, send it to us. When we would receive it, call the patient, get them in, get their x-ray. That time, from when they saw the doctor till the time they saw us, was about 3 to 4 weeks.
Wow. Just to get
An x-ray.
an X-ray. I mean, and that's some of the things that people don't understand. You know, they think so. You're not only military, but now you're adding the bureaucracy of the government involved in the process. So you've got
Yes.
military and government. 3 weeks just to get an X-ray.
To get an x-ray. Now,
Can you imagine that?
that involved other procedures as well in radiology because we cover anything that is related to outpatient services. So we have ultrasounds, CTs, MRIs, mammograms. So there's a whole list of things that we can do. They did not also know that the hospital provided colonoscopies and other services, sleep studies and physical therapy. So when I got a hold of TriWest and I developed those relationships, I said, by the way, did you know we also have these services? If you'd like to use those, instead of sending patients down to the valley, we could do that.
Right.
And they said, oh, you can do that as well. So then our orders escalated pretty fast. That went really well. And then there was still that frustration because doctors wanted to see a patient, get results, and have it back within, say, 24 to 48 hours.
Well, the normal kind of thing that you would
Exactly.
think. Right. Yeah.
Especially if you have, somebody that's, complaining about pain in the shoulder and you just want a real quick diagnosis of what's going on.
Right.
That x-ray is a very fast way, very fast tool to find out. But if you had to wait 3 weeks, you forget about the patient because you've seen hundreds of others since then.
Right.
At this time right now, this VA clinic over here, they have one doctor and then 3 nurse practitioners that work
Yeah.
there. They each see between 20 and 30 patients a day.
Yeah, and you know, I got to say, for the VA clinic that's here,
Yes.
VFW has talked about this. I've talked with the commander there and the second in command there, and they all both say that they do actually a really good job here.
They do.
Working within the framework of what they have. So
It is good, and they've added telemedicine over there, which is really good. The new team that they have under Dr. Reres, I think, has been very good. He's organized it, and the patients are being seen faster, and there's improvements all the time. Of course, you know the VA is going through improvements all along.
Yeah.
So we talked about how would we create a system that would allow us to see the patients right away. So that involved TriWest. TriWest reached out to me and they said, we understand you'd like to try something different. I said,
Right.
let's try a pilot program where we actually see a patient and get the results back, and they get the authorization like ASAP because it's just a simple x-ray.
Okay.
So that developed from January until June, and there were a lot of layers involved here at Summit to make sure that we crossed all the T's and dotted all the I's legally from an aspect for as far as the hospital is concerned.
Yeah.
We came up with an order form. It has a very narrow set of diagnostic procedures, both x-ray as well as lab, that they wanted really fast. That went on the order form, and we called it the pilot program. Once everybody signed off on it, we started that program in June. Since June, we've seen about 80 of those orders come through here, both lab and x-ray. The predominant amount of them are x-rays and not as many labs. But the doctor gets the results within 24 hours.
Crazy. So you went from 2 weeks for somebody to get results to 24 hours.
2 to 3 weeks, yeah, to 24
2
hours.
to 3 weeks.
Yeah.
Yeah.
Which is amazing. And of course, once they get through that diagnostic tool, the next one might be, say, order an MRI. Unfortunately,
Right.
that does take time, but MRI or other procedures, but at least gives them that first tool to find out what's going on.
Okay. So how many people has this aided so far?
Well, at least 80 people.
At least 80.
Yeah, since June. So that we're coming into possibly the third month here. We're now 2 months
Right.
that it's been running, and 80 people. That's doing pretty good. Those are veterans that we saw and got results pretty fast.
Yeah. I mean, if you're looking at just one simple visit, 6 hours per person, that's a lot of time that's been saved.
Yes, it is.
Yeah. So
Yeah.
phenomenal. Well, I mean, 6 hours just driving, and then the 2 weeks, of course.
And we see a lot of patients. This clinic handles everything from Springerville, Concho. I mean, I've had them as far as the New Mexico border,
Right.
coming into this clinic and then being seen here at the hospital. We also have another program through TriWest. It's called the 40 miler program. There were other programs, but the 40 miler program. In other words, if you lived more than 40 miles from the nearest VA anything,
Yes.
then you could constitute a 40 miler program candidate, and you got a special card, and it allowed you to pretty much go to any outside doctor. They would request a TriWest auth, and then you could be seen. Now, just last week, the director, or excuse me, not the director, but the cabinet
Yeah. Secretary. Yeah.
secretary of the VA said that they have now implemented a program in which the veteran can phone in to the doctor,
Phenomenal.
do telemedicine via their phone, get
Right.
the answers they're looking for, order the procedure, get the approval, and send the patient to the hospital or to the provider facility like us.
Well, not to steal a word, that's great.
It is great. It is great because it's improving this system
Yeah.
every step of the
It's
way.
making things great. Awesome.
Absolutely.
Cool. Anything else you'd like to add about the whole program?
The program was not easy. As you know, there were several layers that we had to deal with. And it went all the way to the Secretary of the VA.
Right.
When the program had just been kicked off, it was somewhere in the early part of July. The choice program, that's what all of this fell under,
Right.
the whole TriWest program. They quickly found out they were running out of funds, and it was due to a couple of pilot programs that they kicked off, this one and another one, which allowed veterans to go straight to, say, one of the dock-in boxes at
Oh, yeah. Okay.
CVS.
Right.
And they got paid immediately, and they got to be seen right away. And that's because VA facilities couldn't treat them. Well, the programs were so successful, they drained the funds.
Yeah.
And so they put a kibosh on everything, and they just stopped all the programs, including mine. I immediately wrote a letter to the director of the hospital down in Phoenix, VA, who I had developed a relationship with, and I said, is this true? Because this is painful to hear.
Right.
And I just detailed out where I felt that was really failing the veterans. He forwarded my letter up the chain of command. It went all the way to the secretary of the VA, who said, "It looks to be successful. I'll allow this
I'll allow
one."
this one. Good.
And Dr. Carlos Duarte sent me the letter back, and he didn't say anything except, "Your program is safe."
Nice.
But he attached everybody that had been involved in the email
Right.
back to me, showing, and they had actually highlighted key points on my email about why I felt the program needed to continue.
Very good.
So Congress just decided to add another $4 billion to the choice program to carry us out through the end of this year, fiscal year, which would be September 30th. So we're good to go, at least till September.
Yeah, well, the veterans are the ones that defend our freedoms.
Yes.
They allow us to have the lives that we have here in the United States. And a lot of people take that for granted.
Yes.
Or don't even really understand it because it's deeper than just going, oh, well, what are they doing? So and even when they're not at war or they're not in a war direct conflict, there's a lot of things that our veterans do for us to maintain us as the country that we are.
Well, one of the small things that I think the average person does not know is when you sign that document and you join whatever military branch you joined, it says in the little small paragraph you read it that they basically own you for the rest of your life.
Mm-hmm.
So out of courtesy, I think we should do something for those veterans. And it's sad. The veteran system has been bad, and we read about it in the paper, veterans dying in parking lots and literally dying waiting for services. And so the new VA secretary is doing everything within his power to change that. And he's working against a whole bureaucracy
yeah.
that's fighting him.
One that's been built over decades and decades. So.
But I will tell you, there are people like Summit Healthcare and me in this hospital that care about the veterans and do everything. I'm actually the veteran liaison here at the hospital.
Awesome.
So I go to battle for them. And it doesn't have to happen in just my department. If it's somewhere else in the hospital, I'll go to battle for them to make sure that they get what they need.
Awesome. Well, thank you for your diligence.
Yes.
Thank you for what you do and supporting. And it goes beyond, like you said, it's not just because it's Summit Healthcare. You're looking for bottom line. You're looking to help the veterans who help support us.
Absolutely.
Thank you once again.
Thank
you very much, sir.
I appreciate the time.
So it's David Harder. Thank you very much. That's going to be it for this episode of Summit Healthcare's. I want to remind you out there, everyone, be healthy. Hey, make sure you follow us because Angie Fabian has a 5-story office.
5 stories.
Click up there, click down there. Yeah.